Morning, everyone. How are you? Yep. Yep, very good. Nice day to go to the beach too. Don't ask any questions, then we can get to the beach. Okay. Well, good morning, everyone. Good morning, Queenslanders. Thanks for tuning in. We've got a couple of things to announce today. We'll start off with the COVID update, and I'll invite the Chief Health Officer, Dr. Gerard, to provide an update in just a couple of moments. The first thing I wanted to say is that there will be an update of one of the health directives today, and this update is around taking photos with Santa at Christmas time. So just clarifying that you will be able to take photos with Santa in shopping centres without masks for the photo, and of course then once you're finished taking the photo with Santa, for you to put the mask back on. So a little Christmas present a little bit early for all those kids who want to see Santa. But I'll now invite the Chief Health Officer to provide the COVID update for today.
Thank you very much, Minister. In the last 24 hours, we've seen 42 additional cases of COVID-19 across Queensland. This brings the total to 2,297. 42 may seem like a relatively small number, but you will recall this is double the number we saw just 48 hours ago. So at a doubling rate, if this rate continues, we will see significant numbers in January as predicted. I have had an opportunity to speak to most of the doctors who've been looking after the patients with the diagnosis of COVID-19 in the last 24 hours, and I can say that all of the patients, with the exception of one, have minimal symptoms or no symptoms. The one patient who is moderately unwell and breathless in one of our teaching hospitals was unvaccinated. And it's disappointing to see that at this stage of the pandemic, the once in a 100-year pandemic, when every Queenslander has had an opportunity to get vaccinated, that we are still seeing unvaccinated patients being admitted to hospital with significant symptoms. But I wish this lady well, and hopefully she'll improve soon. At this stage, we have no one in intensive care in our hospitals. We are moving towards. You will be aware that previously we have been admitting all patients with COVID-19 to hospitals in Queensland mostly for infection control purposes. We are moving away from that model, and we are clearing beds to allow capacity in the coming weeks should we require it. I can also tell you that information in the last 24 hours suggests that the Omicron strain is becoming dominant in Queensland, with 21 out of the 25 last tested viruses being found to be the Omicron strain. This is happening very rapidly, again even more rapidly than we originally predicted. We thought that might take weeks. It looks like if this trend continues, it will be dominant within days. Omicron, as we know, is very contagious. It's the very contagious form of the virus, but it appears at this stage that the vaccine is very effective, particularly in preventing severe disease, which is the main thing. Most of the patients that we have seen who've had the Omicron strain who are vaccinated have very mild symptoms. We will be, however, getting more information as the days and weeks go past, particularly from overseas. So we still don't have all the information on that, and I don't want to overstate that, but the vaccines still appear to be effective. Our public health measures must, however, continue, and the particular reason why some of these measures like isolating contacts are important, because we want to allow particularly those that are vulnerable to get a third dose in the coming weeks, a third dose of the vaccine to protect them against severe disease. It's also important, some of our hospital workers, or most of our hospital workers, will have had their vaccine more than 5 months ago. It's also important that they receive a third dose, because we know that makes them less likely to acquire the virus and less likely to be infectious. And there have been now a number of events in the last few days where people working in the healthcare setting have acquired COVID-19. And this is inevitable because the virus is everywhere. The 42 cases that we've seen have been spread now again across the state, right down the east coast of Australia. The latest location, the latest city where we're seeing COVID-19 is Mount Isa. So it's not just the coastal cities that are affected, now it's the inland cities. So all Queenslanders must consider themselves potentially exposed, or that it is likely that most Queenslanders will be potentially exposed to this virus in the coming weeks, and our behaviour needs to reflect that. Obviously, we all need to get vaccinated. For the few of us that haven't received our first dose, please go off and get that first dose. But for those who are 5 months after receiving their second dose, it's a good idea now to get a booster, particularly if you're older and vulnerable. In terms of more information, we have 142 cases currently active. We completed 18,312 tests yesterday, 14,615 vaccines were administered in Queensland yesterday, mostly by Queensland Health, or that's by Queensland Health sites. Now 89.53% of the Queensland population is double dose vaccinated and 84.22% single dose vaccinated. So we would expect the 90% single dose target to be reached sometime in the middle of this coming week. Okay, I think that's all I want to say about Omicron today. Thank you.
So I'll get the Commissioner to provide her update, and then we'll take some questions on COVID.
Good morning, everyone. I'll just give you some update in terms of what's happening across the state with some statistics, and obviously with the new requirements in clubs, pubs, restaurants, etc. So since the state opened up at 1 a.m. last Monday morning, we've had 171,287 GV applications made. That's 35,000 just on what we had yesterday, and also 1,200 international home quarantine applications as well. We've handed out 382 masks, and there has been some enforcement action in terms of masks. Remember, masks are compulsory in certain settings. So in the Wide Bay Burnett district at the Hinkler Shopping Centre, a male and female were reported for not wearing a mask. Police obviously approached those people who became extraordinarily aggressive and refused to be handed a mask and refused to wear a mask, were subsequently arrested as a result. On the Gold Coast yesterday, 4 adult cautions were issued for people at Pancakes in Paradise. Further action investigation is taking place in relation to that for obviously failing to comply with the direction of being fully vaccinated to enter such premises. Other matters that we've had, which to me is completely unacceptable and disappointing in many ways, at the Sunshine Coast University Hospital, a security officer was assaulted yesterday at 2 p.m. when a Coolum man was there for his second vaccination and became extraordinarily agitated and impatient because it was taking a while, and therefore assaulted a security officer and has subsequently been charged with that assault. A couple of other things: a person on the Gold Coast who was supposed to be in home quarantine, and this is where we do those compliance checks to make sure that people are abiding by that, was not located at his home, and as a result was located at the Robina Shopping Centre, was also issued with a fine for failing to abide by a health direction and return to his house. And in Mergen, a 53-year-old person who entered licensed premises without being fully vaccinated, became abusive and obviously continued to abuse staff. Police have removed that person, and he was fined as well. So from my perspective, things are going extraordinarily well in terms of the new directive. However, as you've seen in the last 24 hours, disappointingly, some people have become quite aggressive and abusive towards staff, security officers and the police, and as a result have either been fined or arrested. For non-compliant patrons, in the last 24 hours, 55 calls for service, and businesses, 98 calls for services. Once again, a lot of that has related to just understanding the new system, but as I said, 4 adult cautions have been issued and further investigations have been carried out on the Gold Coast in relation to that restaurant that I have just mentioned. I might leave it at that and we'll ask for questions. I mean, do you want to do that now before you go on?
Commissioner,
yes.
There are reports that some of the police officers in the Beenleigh station have been exposed to COVID. Is that station now closed, and what impact will that have on policing?
So we have got one of our police officers from that station has been tested positive to COVID. That is as a result of the Burleigh gym cluster some days ago. That officer at this stage we know was at a party with other officers from Beenleigh and Eagleby Beat. All of those people are isolated and they are being tested. That officer is at home, he is quite well, and as you know, from the very outset we planned for this and we actually anticipated this. We started our compulsory vaccination program some months ago, so all of our police other than 100 and all of our staff other than 65 are fully vaccinated. And in fact, thankfully in that part of the world and on the Gold Coast, a lot have already got their booster shots. So yes, we have started our business continuity plan. Beenleigh and other areas are being covered by Coomera and some of our specialist areas. This work is currently being done as we speak. We are working with Queensland Public Health to ensure what other measures need to take place. But we believe at this stage it is between 20-25 officers that are isolated with their families, working with the public health as well as being tested at the same time.
Well, do you know how long they'll have to isolate? Will it be the 14 days of a close contact? Like down in New South Wales, they only do 7 days.
So definitely, as I said, a lot of those, or all officers are double vaccinated as well as the booster shot. So that's the work that's being conducted with public health at the moment. This only came to light yesterday, so a lot of work being done in terms of rostering, you know, who's covering that area, as well as the work of isolation into the future.
Is the Beenleigh station closed to members of the public?
No, definitely not. So not all members went to that party. In fact, the officer in charge who's there doing the rostering today didn't. So many officers didn't go to that party. So, and those officers are still there, but also we need to know who was at the party, and I know there was other people at that restaurant as well that have had to isolate. Who was at the party, who's isolating, how many, what other areas did they access during their infectious period? All of that is being done at the moment.
Commissioner, what's your estimate on the number of border crossings via road since Monday?
Could I get you those numbers after this, if that's okay? Oh,
What's the rough idea?
well, I'll just get you some numbers now because it is quite substantial. For instance, just
Outside the border bubble, that is.
well, I do know that 40,000 vehicles that we counted come through yesterday, but the numbers are surely are more than that.
That's outside the...
I can't give you the numbers outside the bubble though, but I'll try. If I can, I'll try and get them to you.
Can I just ask Dr. Gerard, are you concerned by what's happening in Europe at the moment with lockdowns and such? Sure you are, but what's your view as to how that relates to here in our pathway in Queensland?
It's quite difficult to judge at this stage. Each country in Europe is seeing different things in terms of the number of hospital admissions and deaths associated with the recent outbreak. Remember that in Europe, they started their vaccination program earlier than us, so to what extent that is making a difference in terms of the protection that they are now seeing as they go into the winter months. We started a little bit later, which in some ways is fortuitous, and it also means that we will have an opportunity, particularly for those who are vulnerable, to get those third doses in. It's also, this is an, if we are going to allow the virus to spread, which is A, inevitable, and B, necessary, this is the best time to be doing it. It's summer, schools are closed, this is the time. So this will give us an opportunity to see what happens, but what is happening in Europe, it's hard to project what's happening there to what's happening here in Queensland.
But the initial indications that Omicron is a weaker strain.
Oh, I'm sorry.
Is it your understanding the initial indications are that Omicron is weaker than Delta in terms of its health impact, or is it the view too early to say?
I think we should wait for more data to come out. I think we still have to treat this very seriously, but the early data suggests that the vaccines that we are given are very effective, particularly for those first 5 months, and after the 5 months, the booster as well, but probably even beyond 5 months in terms of preventing severe disease.
Doctor, the government said to people travelling to Queensland from Monday that on day 5 of their stay they would have to get a COVID test. The daily average COVID testing before the border was open was 12,000. According to the latest figures yesterday, that's shot up to 14,000 and then 16,000. Why is it that thousands of people that have arrived here since Monday have not had a COVID test?
Well, we are relying on the people to do the right thing in terms of getting that test, and I think Queenslanders will get that test.
What about people travelling to Queensland? That's a condition imposed on them by the Premier, by the Health Minister, the threat of quarantine and penalties. Do you think thousands of people will be willing to take that risk by not getting the COVID test, or is the system just not capable?
The system is capable of testing the required number of people that have crossed the border. There has been detailed planning for this, and we are relying on the goodwill and the consciences of those people who have crossed the border to get.
Those thousands of people who have not been tested, according to the instructions from the Premier, according to the law outlined by the Health Minister, are deliberately breaking the law and risking quarantine and penalties. That's what you're suggesting. And if so, what are the chances of their detection, of their punishment?
I think it's too early to say how many of them are going to be tested. Let's see in the next few days.
That's not what the Premier said, though. She came out and was quite explicit about the threat of penalties for people who did not receive a COVID test on day 5. 30,000 a day has been the capacity so far. So far you're doing 2,000 beyond what was the daily average before the border opened. How do you explain that?
Well, if people aren't getting tested, they do risk penalties if they are caught.
Commissioner, can we ask you for an update on
Sorry. In New South Wales, I guess they obviously have more cases, but some health staff at hospitals are having to come off their Christmas leave early, I guess, to tend to that demand. Is that happening in Queensland yet? What's the rostering like at the moment?
Not at this stage, because the demand on the hospitals has not increased at this stage, and we don't expect it to around Christmas time. In fact, the patients that we had in previously with COVID, some of them are actually being sent home because we've had patients in our COVID wards who are there for quarantine purposes. So at the moment, staffing is not an issue in our hospitals and the COVID wards.
Do we have an updated date for January when we hit 90% double dose if we potentially going to hit first dose this week?
I have not seen an updated date. It's sometime in January.
With the high number of cases we've seen since the border reopened, do you think it's likely there's a high number of people that haven't been truthful in their border application when they've declared they've tested negative to COVID if they're coming from a hospital?
Well, they have to be able to demonstrate through the app that they have been tested, so it's not something that one could easily forge. They would have. No, I don't believe so.
Do you think moving forward it becomes almost more helpful to talk in terms of hospitalisations rather than raw numbers? Because the numbers sound extraordinarily high, but if few people are actually sick.
Absolutely, that is what we will be doing. That's absolutely a very good point. But looking at the number of cases in Queensland specifically at the moment, whilst the case numbers are small, is quite useful for us to sort of gain some idea of when we're going to start seeing hospitalisations, if we do. So it's useful for us at the moment to look at cases, but as we move forward, we'll start looking at hospitalisations only.
Commissioner,
Is it the best time for the virus to be spreading through the community right now? Why?
Well, we know that the two main reasons. One, the warmer weather. We know that cool weather, when people crowd indoors, is when the virus is most likely to spread. We know this is principally a a disease seen in the wintertime. That's one reason. And the other reason is we have schools on holidays, and it will give school kids an opportunity in January to get vaccinated.
That's of the 42 cases as well. How many of those are community transmissions? And then,
Okay.
and then second to that, you mentioned Mount Isa's a new sort of location. Are there other new areas that Mount Isa is being
That's the one new location that I'm aware of. Of the 42 cases reported in the last 24 hours, 24 are still under investigation. 1 case is overseas acquired and detected in quarantine. 7 are linked to interstate travel. 8 are contacts of known cases. And 2 cases do not have a link to a case or an exposure venue and have no history of interstate travel. So those are of concern because clearly they've acquired it in the community somehow. But we believe that there are undetected cases in the community, and we have to assume that.
Well, so how many penalties have been issued to people who haven't failed getting COVID tests done? How many penalties have been issued?
The 5-day test.
Yeah, from the thousands of people who have failed to get the COVID test, how many penalties have been issued?
As far as no, there have been no penalties issued, as far as I'm aware.
Premier's on December 6th. If I don't get the COVID test done day 5, penalties will be issued. Was that an empty threat?
Look, we're relying on people's honesty and the fact that they're going to do the right thing.
Are you seriously suggesting thousands of people deliberately doing the right thing? Is that what you're suggesting?
We are relying on people to be honest and do the right thing.
Commissioner, could I ask for an update on this search and rescue that's happening right now?
Thank you. Look, I can confirm at the moment that there has been a light plane crash at the end of the runway at Redcliffe earlier today, only an hour or so ago. The plane is in a very, very difficult situation, difficult position in the wetland area, and we have currently got police and divers travelling to that area, and that's all I can say at this stage.
No idea how many passengers?
I can't confirm the number of passengers, and obviously I would not like to do that and find something different, so we just can't confirm that at this stage. Thank you.
How many people were turned away at the border over the last 24 hours?
Yes, I can. Can I have a look at that? Because there will be different numbers on the roads compared to the numbers, obviously. Okay, so a number of flights from hotspots were 197. 16 people refused entry and 104 were put into hotel quarantine. And I touched on this before. This is because they don't have their PCR test and are waiting for that. Vehicles intercepted, 39,190 vehicles were turned around, obviously because their issues, didn't have their border pass or couldn't fulfil the criteria. 1,162 heavy vehicles were intercepted, and of those, 8 of them were turned around. And yeah, I think I've given you all of them. Thanks.
Commissioner, just
Yes.
last night on the Gold Coast, 2 17-year-old students on school in New South Wales were identified as a risk of COVID-free after their test on Friday. A good friend who was found to be COVID positive. They were told they were going to go into quarantine for 2 weeks with 17-year-olds. But they were forced to wait on a curbside for 4 hours before they were taken to a quarantine hotel and processed by your officers. Is that ideal? Hundreds of people walking past at that time?
Well, I don't know what the circumstances were, but I leave it up to the officers to make those very important decisions. There may be reasons for that, whether they had...
Queensland Health responsibility. It was a COVID taxi that came to get them eventually.
Well, it may be the case, but the thing is, you know, they're children still. They may be waiting for parents, so...
No, they weren't. They were 17 travelling independently.
Well, there are many reasons why that may be the case, and until I'm properly briefed as to why they were there and why it took so long, I can't comment. Thank you.
So that's it for COVID. Okay, thanks very much. Well, very pleased to be here to celebrate with some of our health heroes and investment in the front line. We know that as communities grow and as more and more people rely on our health system, we need to continue to invest in the front line. Already this year, the government's invested in $263 million in additional funding for Queensland Health to meet the ever-increasing demand. What's that's seen so far to date is 179 additional ambulance officers and over 100 additional or new and replacement ambulance vehicles. But today we go the step further and announce even more support for the front line. So very pleased to see that over the next couple of months we'll be seeing an extra 108 ambulance officers join the front line. And 44 of those will be online within the next couple of weeks, with the balance due by March 2022. So we're seeing, of course, that investment in the front line already having some positive impact on the service delivery from the Queensland Ambulance Service and Queensland Health. In fact, we've seen numbers around wait times reduce, as well as also capacity increase. But that comes also in the context of very busy health demand. And a record was broken in the September quarter with almost 630,000 admissions to an emergency department in that 3 months alone. So, of course, with that increasing demand means a requirement and a need to invest further in the front line. And I wanted to commend those Queenslanders who have stepped up and wanted to serve their community by wanting to join the Queensland Ambulance Service. As I said, in the next couple of months, we'll see an extra 108 of those join the front line, and I wanted to commend them for stepping up and wanting to be of service to their community. But more broadly, I wanted to also thank and commend every single member of our emergency services and our health services for the outstanding work that they've done, particularly over the last 2 years. It has been extraordinary. There's more work to do, but to all of those health workers, to all of those emergency service workers and police officers who will be working over Christmas, we say thank you from a grateful community and know that Queenslanders are extremely grateful for the service that you have done to date and will continue to do on our behalf. I've got a couple of people here who will talk about this exciting news. I'll firstly invite the local member, Ali King, for the Bribie Island area to make some remarks, and then we've got Dr Rashford from Queensland Ambulance Service.
Thank you, Minister, and welcome everybody to beautiful Bribie Island. I must say that 108 new ambulance officers for right across Queensland, but more importantly for my community here in Palmerston, 15 new ambulance officers to look after us here in the Metro North area and particularly for our community here on Bribie Island is just the best Christmas news possible. And we know it's very much needed. We're an ageing community here on Bribie, and of course we're facing a GP crisis with very long waits for appointments, so there is significant demand on our health system here. So it is excellent, excellent news, and it's been wonderful to speak to some of our new recruits today as well as some of the long-standing officers who serve our local community on a regular basis, like Jared. The last time I stood here was to announce our satellite hospitals would be built for here on Bribie and at Caboolture, and just over a year later we're almost ready to begin construction. So this is the next step in a very long history of investment in our local healthcare system here in our area, and I'm really proud to be part of a government that always puts the local health needs of our community first. With that, I will just give everybody in our local area a reminder. It is now with updated advice that you can get your COVID-19 booster 5 months after your second dose. I had mine on Thursday. I'm feeling great. You can head into the Caboolture Square vaccination hub or to one of our GPs or to one of our wonderful pharmacies, which is where I went to get mine, and get yours, because the very best Christmas gift we can all give each other is to be protected from COVID-19. But with that, can I just celebrate this wonderful announcement of new ambulance officers for our community. I couldn't be more grateful and more delighted to welcome them here to Bribie and to the broader Palmerston community. Merry Christmas, everyone.
Thank you very much, Minister, Ms King. Just wait for our fantastic paramedics to wander behind. It'll be a fantastic backdrop. Obviously, we really welcome this investment. It's an investment in young Queenslanders who will take on a 30 to 40-year career with the Queensland Ambulance Service. And this is just the start of their journey, and what a time to start it at a time when we're facing a pandemic, increased workload due to that. But I can't think of a more exciting time to welcome these highly intelligent healthcare providers into our service. Our paramedics, our patient transport officers, our operations centre staff are at the front line of COVID. This 108 additional staff on top of what we've already been provided by government will further allow us to posture and be ready for anything that COVID presents to us. The Queensland Ambulance Service is a mobile emergency health service across Queensland. You've heard that we have cases across the entire state. We need to be prepared for that. With these additional staff, we will be that way, and we feel well prepared to help Queenslanders at their time of need. Any questions about this?
So this is part of the $260 million boost for Queensland Health. So it's over and above, you know, obviously the standard baseline funding for Queensland Health. It is a boost. They are growth numbers. This is an extra resource for the Queensland community.
So in the budget, there were 470 new paramedics that were planned to be rolled out over 4 years. Is that part of that group?
Look, I'd have to get you the specific details on that. Obviously, here representing the Health Minister, who's on well-deserved leave, we can get you the specific details around that. I'm not familiar with the specifics around the budget papers.
Minister, new officers are one thing, but what's being done to create more hospital beds in emergency departments to prevent that bottleneck, that rampant?
Yeah, I'm very pleased you asked, because only about 20 minutes that way, we're doubling the size of the Caboolture Hospital. We're spending $400 million to create almost 130 extra beds, a massive new emergency department, and that is one of just a number of emergency centre and hospital expansions right across the state. We're also building 7 new satellite hospitals as well. Many of them will have an urgent care service, so again relieving pressure on the system. So not only are we investing in the health infrastructure with new buildings, new facilities, but we're also investing in the staff that's required, not only in the ambulance service but in the hospital services as well.
Minister, with new paramedics, will that be enough though if you have ambulances piling up at hospitals with beds that are full?
Yeah, well, it's well appreciated that there is increasing demand on the health system. Any extra resourcing that we can provide to support our health services and the work that ambulance officers do is, I'm sure, very welcome by the people of Queensland. So this is an extra 108 on top of the 179 already delivered this financial year. And of course complements the additional investments in those infrastructure improvements, which will also increase capacity at the hospital end to ensure that people can get into hospital and our ambulance officers can get back on the road as quickly as possible.
Are you concerned though that these additional paramedics will just end up maybe at a hospital?
Well, this is all about investing in the entire spectrum of the health system. So not only do you invest at the front end with the ambulance officers, the additional vehicles, the additional ambulance officers, but you also invest at the back end, and that's what we're seeing now, you know, down the road at Caboolture, at a number of other major hospitals throughout southeast Queensland and across the state, and also those new satellite hospitals. All of that is about the spectrum of investment, and all of that will go some way to addressing the ever-increasing demand.
Do you know how many paramedics usually resign through natural attrition every year?
Fair dinkum, Josh. Yeah, we can get you those details. I'm not the Minister responsible for ambulance services, but we'll...
It would be like a general figure. If you're saying you've got 108 about to come online.
These are growth numbers. These are growth numbers, so they're over and above attrition. You know, if you ask me about how many police officers or firefighters, I could probably rattle those numbers off for you, but on ambulance officers, it's outside my ministerial portfolio area.
In the public service workforce figures that were released this week, it looks like police figures have gone down 50.
Sorry, what was that?
In the public service workforce figures that were released this week,
Mm.
from September last year to this year, there's 50 less police officers. Do you know why that is?
It's a point in time, so often you'll have people retire at a particular date at a particular time. We've got an extraordinary investment in the policing service, so now we've got over 12,000 sworn officers, over 17,000 people in the police service. We're actually increasing that by 2,000 by 2025. There is significant growth going on. Only 2 days ago, I was at one of the biggest graduations that we've had in many years, over 110 new police officers. There's another graduation in a couple of months and then another one after that. So there's significant growth going on. Sometimes when you've got a point in time between when people retire and when new recruits start, you'll have some variability with those small numbers. But overall, there's a significant increase, and the graduation just a couple of days ago proves that.
What do you make also of the protesters on the Adani mine site that have been flying in, bringing alcohol and allegedly hurling abuse at staff there?
Yeah, I think all Queenslanders condemn anyone who breaks the law when they go about, so-called exercising their rights to protest. Of course, Queenslanders support people's right to protest with one condition. It's done lawfully and it's done respectfully. I know police are looking very closely at these matters, and I also know that the Commissioner and others are meeting with some key stakeholders during this next week to discuss ways forward. But can I remind anyone who wishes to exercise their right to protest, you can do so, but do it lawfully and respectfully, and then you'll be able to carry out that democratic right that you've got without consequence.
This has apparently been going on for months. Do you know why it's taken so long for any sort of action?
Well, I'm not going to get into a critique around the discretion of police officers that they have when they engage with people. There's many different options that police officers have when they engage with people who may be breaking the law, and we've seen that through COVID. The primary posture that the police have taken is one of communication, compassion and then compliance. And police officers have that discretion to engage with people who might be conducting themselves contrary to law in any matter, in any respect. So I'm not going to have a critique of the actions police have taken. I know that police take all of their action very seriously. They are very reflective and considerate of all of the actions that they take. And as I said, the Commissioner and others are meeting with some key stakeholders this week to discuss some other options moving forward. Very good. Excellent. Thanks, everyone. Thank you. Well done, everyone. Do you know there's a thing called a beer tax or a media tax? If you end up on TV, you've got to shout your colleagues a beer. So I'll be watching tonight. Dr. Rashford buys a lot of people. Doesn't apply to politicians.